Everyone, and now let's have the continuation of last class. So that is shortwave diathermy. So in this class we are going to discuss what are the different methods of shortwave diathermy applications. So usually there are two methods. One is capacitive method, another one is inductive method. So through these two method we can go with treatment of shortwave diathermy machine. So first we will see what is mean by capacitive method and what are the subdivision of capacitive method, followed by we can see the inductive method and their subdivision. So in capacitive method we have two types, that is airspace plates and pad electrodes. In inductive method we have other two types, that is the cables and drums. So in capacitive method here we will be using the two set of two electrodes, that is one set of electrodes. So through this electrodes we will be passing the high frequency alternating current, which is nothing but short wave high frequency radiation. So this high frequency current will pass from one electrode to another electrode to produce the heating effect. So in this type of capacitive electrode, if you see, the patient will be become the part of the electric circuit, because the electrodes we will be placing on the either side of the body. Either we will place on a side of the body, that is a targeted area, or you can place in over the body in parallel to the body. So this is the area, this is the position where we can place these electrodes in case of capacitive method. So the area to be treated is usually placed between this electrode, so that that particular part is becomes a part of the external circuit. The reason is that the high frequency current, the high frequency current whatever you have said, that is radio frequency current, will pass from one electrode to another electrode through this area to be treated. So that is the reason in capacitive method, that area, the targeted area which you need to be treated, it's become part of the electric circuit. So through this way we are inducing the heating effect inside the body by the mechanism of the interaction of molecules, biomolecules inside the tissue. So in the subtypes of this capacitive method is that one is airspace plates, another one is like um, pad electrodes. In airspace plates, if you see, the metal plate is will not make a direct contact with the skin. The reason is that you have to have some insulation over this metal plate, because if you make direct contact, or the skin will not tolerate that much of heat, so which will end up with some sort of burnout. So that is the reason in case of capacitive method we will be having the insulation material. In airspace plates we will be covering with some sort of housing material, which is insulating material. So the metal plate which is slightly adjusted about the 3 centimeter above the insulation material, or you can see the gauze, so it will not have a direct contact with the skin. So in this way we can avoid other side effects like or the risk like burning out. So this is the main manufacture or the structure of airspace plates. So whereas if you see pad electrodes, it is almost seems like a rectangular size, big size pad. These pad is usually covered with malleable material, which is one kind of insulated material, which will give you a thin layer of rubber over the metal plate. So in this way we are providing the insulation so that we can avoid some sort of risk when we are placing by using this pad electrodes. So this is the other type of capacitive method. So usually you have two types, one is airspace, another one is pad electrodes. In both case we are not placing that metal plate directly to the skin, because the metal plate, if you are placing directly to the skin, it will leads to some risk, that is a burning risk. So in order to prevent this burn, we can either go with airspace, that is where we have a special gauze insulated material which will prevent the direct contact of metal plate from the skin. In case of parallel roads, we also here also we have covered this metal plate with help of malleable thin layer of rubber, or you can have you can also use your towels if you in case of using high frequency current, or you, for prolonged duration, the treatment is going for prolonged duration for particular area. So these are two types for capacitive electrode. Where second type of shortwave diathermy, as I said before, it is the inductive method. In this inductive method, we are using inductive field, that is electromagnetic field. Here we will be using other two types of electrode. One is a cable electrodes, another one is the drum electrodes. In case of cable electrodes, here the wires we will be cable. The wire, that is nothing but a cable. We will be wrapped around the extremity where you want to treat it, or else you can rotate, or you can coil like a pancake, and we'll just place it on the skin where you want to treat. So these are the two way you can go with the cable type of electrodes. So one is you can just wrap it around the extremities, whether it is a leg or a hand where you want to treat, or you can go with the coiling the cable like a pancake, or just you can place it on the area where you want to treat. So in case of inductive method, once you apply the high frequency electric current, these electric current will, which in turn produce the magnetic field whenever the electric current carries in metal wire or metal coil, right? So these a magnetic field which in turns produce what, eddy current, which these eddy current will involved in influence of interaction with the biomolecules inside the tissue, which end up with the heat production and a rise in temperature, and healing effect will take place. So this is the basic mechanism of inductive methods. So as I said before, these are the picture of how the cable electrodes can be placed. In one side we can see it is just we can wrap around your extremities. In other side you can just coil like a pancake, and we place it on the area where you want to treat. So these are the two ways you can use the cable electrodes. And also, the as I said, the second type is the drum electrodes. So these drum electrodes, it's same like a cable electrodes. Here also you have the coil which is placed inside the drum. So you can see the spiral like coil. So this is the coil which is going to carry the radio frequency current. So whenever these high frequency electric current passes through this coil, which will produce a magnetic field. This magnetic field will induced in turn eddy current. That eddy current involves in your biomolecules interactions. So this is how the drum electrode will works on. Depth of penetration for capacitor is just superficial, whereas the inductive is the deep penetrations. So depth of heating is very deep. So like you can go with the application like deep muscle vascular tissues for inductive type, whereas if you see for capacitive, we can go with the superficial treatment like joints, ligaments, and low fat areas. So these are the two different types you can see with the shortwave diathermy. So with followed by you have applications, because in capacitive wave it is good at superficial treatment, and the inductive type it is good at deep penetration treatment. Yes, thank you.